evening and welcome to another interesting package of the program, Easy Access to Healthcare for All, bringing you news and happenings around the National Health Insurance Authority and the health insurance space as it makes efforts towards attainment of universal health coverage. I am Aisha Muhammad Ahmed, your anchor on the program. The automation of the NHIA business processes will go a long way in helping the authority achieve its mandate, as it will create interoperability between stakeholders, thereby resulting to seamless operation within the health insurance space. It is to this end that the authority held a one-day meeting to receive and examine the report on NHIA Digital Technology for Business Process and Dashboard to see how it works within its operational processes. Please stay tuned as we bring you details of this meeting alongside other segments of the program. Don't go away.
It is a program that is designed to ensure nobody is left behind in the health insurance ecosystem.
It's an excellent scheme to support Nigerians.
I've been benefiting from this scheme.
It's very nice. We're really enjoying it.
We appreciate their effort.
First on the program is a highlight of events around the NHIA. In the news, NHIA DG says NHIA Act will speed up Nigeria's universal health coverage. These and more stories coming up shortly.
In a bid to give Nigerians accessible and quality health care, the National Health Insurance Authority on Monday, the 17th of October 2022, signed a memorandum of understanding with Pfizer on dispensing of critical antibiotic medicines for treatment of infections. Speaking at the event, Professor Nasir Mohammed Sambo, who was represented by Mr. John Oko, General Manager Finance, said the authority is partnering pharmaceutical companies to make drugs available, affordable, accessible, and acceptable to enrollees, which is key with the NHIA Medicine Supply Initiative. He added that this move is a milestone that will improve the health status of Nigerians.
Pfizer Limited is partnering, collaborating with the authority in a cost-sharing arrangement to make its brand of the medicine, which is an antibiotic. I'm not a medical person, so I might not be able to. Which is an antibiotic, more affordable to Nigerians. Under this arrangement, Pfizer will provide the molecules to NHS at 50% of its cost.
Speaking in an interview, Olayinka Subail, Pfizer West Africa country manager, said the partnership is significant and the success will be seen when patients begin to access care and mortality from infectious diseases reduce.
What we have done today is a significant step, signing the contract. However, we are also working with the agency to ensure that the 6 geopolitical regions are well represented. So the success to us will begin to happen when the patient have access to the medicine and we begin to have a reduction in mortality arising from infectious diseases within the Nigerian airspace. So the benefits is mainly to the patient, and when we begin to record a reduction in mortality, then we're talking about success.
Under this arrangement, Pfizer will bear 50% of the cost of drugs, while NHIA will bear 30% and enrollees bear 20% of the cost. The Director General of the National Health Insurance Authority, NHIA, Professor Mohammed Sambo, has assured the international health policy community that the NHIA Act recently signed into law by President Muhammadu Buhari will accelerate the country's efforts to bring access to healthcare to all Nigerians within the projected period. Sambo gave this assurance at the Royal Institute of International Affairs, popularly known as the Chatham House in London. In a paper titled Institutional Leadership for Universal Health Coverage in Nigeria, Sambo noted that the Act provides the legal muscle to rapidly increase coverage by making health insurance mandatory for all Nigerians and legal residents. adding that this had been the single most significant impediment to the attainment of universal health coverage before now. Reflecting on the history of health insurance in Nigeria, the health insurance boss traced the 23-year trajectory of the frontline health insurance regulator from a previously unstable organization to the transition into the present respected institution. He further stressed that the reforms initiated when he took office 3 years ago is beginning to reflect significantly on the entire ecosystem. Sambo noted that the reforms embarked upon had brought stability, unity of purpose, and progress to a decentralized ecosystem, adding that with the laying of a strong foundation, the superstructure holds the prospects of development at subnational level. Expressing the commitment of the NHIA to implement both the spirit and the letter of the legislation, Sambo highlighted the thematic areas of implementation to include legal and regulatory, financial and technical, and advocacy and sensitization, adding that all relevant stakeholders have been engaged and the support and buy-in have allowed the smooth implementation of the Act. Engagement was organized by the Commission for Universal Health Coverage and the Public Health Africa Policy of the Chatham House drew participants from Nigeria's political leadership, such as governors of Gombe, Lagos, and Nasarawa states, under the theme Universal Health Coverage in Nigeria, Optimizing Institutional Opportunities and Partnership for Success.
The program is easy access to healthcare for all, bringing you news and issues around the National Health Insurance Authority. Information communication technology is the way to go, especially in service delivery, and that is where the NHIA is heading as it pursues universal health coverage for Nigerians. Our next segment will let you know how the NHIA is deploying ICT to its business processes to better serve Nigerians and improve the efficiency of its services. Please don't go away.
The NHIA project is a critical national infrastructure built to support the automation of the NHIA processes. The good thing about the entire automation process is that it is being programmed and managed by Nigerians, making sustainability and maintenance easily within reach. Apart from health insurance services and actualizing universal health coverage, it will give Nigerians access to healthcare anywhere. It is in that line that the NHIA organized a one-day meeting on the report of the retreat on digital technology for business process and dashboard. The meeting is a follow-up on the NHIA retreat that held in August 2022 and had in attendance members of top management committee alongside NICECOM SAT and Integrated Healthcare Strategies and Analytics Limited, who both play a key role in this project.
Business process so that
Professor Nasser Mohammed, while giving the opening remarks, said the purpose of the meeting was to see how the NHIA business processes can be aligned to the NHIA so that it can be digitally driven.
you all know the historical antecedent of why we need to have the business process. There has been a lot of uncertainties within the organization. Activities are not fully defined within the departments, and activities are not being defined clearly that will foster interrelationship between the departments. So we recognize the fact that we need to have a very deep business process so that everything is spelled out. The department knows where they start, and they will know where they will stop. And the other department know also where they will start and where they will end. By the time we finish this business process, each department will now also go back to develop job description for every staff of his department. so that if you are in this unit, you know your roles and responsibility. If you are in another unit, you know your roles and responsibility.
Mr. Joseph Amakrobongo, Acting General Manager, ICT, read out the objectives of the meeting.
We're going to look at the opportunities involved in the NHIA, that's being a critical national infrastructure, NHIA being a vehicle for super NIMSI agent for enrollment and verification. We also are looking at the capacity to take us to the service, self-service. Then we look at all that you see there because of our time.
The meeting was chaired by Dr. Mohamed Jibril Abdullahi. He speaks on the methodology of the retreat, highlights of keynote address and presentation.
Whatever we are doing today is within the context of the 3-point agenda. It nurtured 10-year strategic plan. It gave all of you the idea that you need to transform from a scheme to an agency, and you know the implication. Because he was in the system, he knew that there were encumbrances in the existing law, which does not make the scheme mandatory. So part of the key strategic reforms in the agency was this transformation. And most importantly, again, like I mentioned, he's looking at digital transformation as key to ensuring that NHIA is able to achieve all its visions, the mission, and the goals that are clearly indicated in the 10-year strategic plan. And he mentioned that the work has just begun. And there's also, a lot of work has been done. But then, it's just beginning.
The meeting had 4 technical sessions, a step-by-step presentation of the 9 operational processes, starting with enrollment and ending with data management.
The responsible organ is FSD for enrollment. But we also know that ISD is also involved somehow. And that's why we thought we'll not be repeating the enrollment for FSD and the enrollment for ISD. But we know ISD is very much involved in the basic healthcare provision fund. And we didn't want a state where we'll be discussing enrollment for FSD, and then when we now get to enrollment, we'll be discussing enrollment especially for ISD. But we know the relevance of ISD. That's why we brought the basic healthcare provision automation process, so that we can make reference to this particular process. There could be some differences in terms of targets, in terms of processes.
Other operational processes discussed include contribution, collection, accreditation process, health service management, and many more.
The automation of the health insurance.
Speaking at the end of the meeting, Mr. Joseph Amakrobongo explains more about the automation of the NHIA business process.
Software development is a cycle. When I mean a cycle, it's cyclic in nature. When you use a system, you will recall that this NHIA automation started a few years back, and at the point of starting, it was also supporting the system. So we have had this infrastructure that is being used and solution that is being used. Then we now got feedback from the users. So with this feedback, you now build in those business processes, and you have more or less an improved system in what we call a system re-engineering, so that it can answer to the feedback, the gaps that we discovered. Then you have an update and in some cases an upgrade of the existing system.
Also, in an interview, stakeholders spoke on the outcome of the meeting as it affects them.
For projects like this to work and be sustainable and to make sure that everybody is deeply involved, you need the buy-in of the top management. So this meeting specifically is to bring in all the GMs and top management, including the zonal coordinators.
We are the solution developer and implementer for ENHIS. In all the meeting we have, the first meeting, for instance, is for us to review the business processes. The business processes to look at the workflow of NHIS and then convert it to a data, then to now automate the entire business process. So some of the data we gather, we use it for the improvement of the software development.
You're still watching Easy Access to Healthcare for All Nigerians, and in this segment, we shall take a look at stakeholders in the scheme and how they have been partnering with the NHIA to give Nigerians easy access to healthcare. In this episode, we shall be hearing from Dr. Farouk Ahmed Buhari, a regional manager at the Songhai Northeast office. The Songhai Health Maintenance Organization is a service provider under the NHIA and has various offices within Nigeria. Dr. Buhari speaks generally on the health sector in Nigeria. He said, it is evolving but needs more attention from the government.
Health sector in Nigeria is a very promising sector, but definitely we cannot say without so many challenges and problems. Of recent, to me, health sector is a sector that is supposed to be looked upon with utmost attention and care. For example, we have so many vulnerable people that are covering over 70% of the population. They need care. And in fact, that's why the federal government comes with NHIS. So as maybe people will get access, too many people will get access to health care easily and affordably.
He describes the emergence of NHIA as timely, saying it is a lifesaver and came when it was needed most.
It's timely. The NHS has come in and their coming is timely. For example, before the emergence of NHIS, people are really suffering. Hospitals are not helping matters because so many people, you can be a witness that so many people can lose their lives for just 3,000 naira drugs. But with the coming of NHIS, it has come with a lot of programs. For example, this CBSHIP, community-based social, which is a very laudable program. It goes a long way in alleviating the health problems of the rural dwellers. So to say, if at all, these people, all people concerned, if they can put their minds together to make it accessible, it will be something that is very good in future.
Dr. Buhari says Health Maintenance Organization serves as an intermediary between the NHIA and the healthcare facilities and maintains a three-tier relationship with both NHIA and providers.
They are intermediary. NHIS has come up with a program like a three-tier something. We have the NHIS, we have the facilities that are the hospitals, and we have the health maintenance organizations that are companies like my own. So these three form the whole program of NHIS. They work hand in hand. NHIS serves as a regulator. It oversees the affairs of HMOs. It intermediates between the facilities and the HMOs. So it accredits hospitals. It makes sure that hospitals meet the standard before it gives you license to operate. So I can say it's a three-tier, so it's the NHIS, HMO, and hospitals.
He tells us more about the relationship between the NHIA and the health maintenance organizations in achieving its responsibilities towards enrollees.
NHIS has to oversee the affairs of HMOs to make sure the HMOs are paying the facilities when due. You understand? And any problem that crosses between facilities and HMOs, it is NHIS that intervenes.
Dr. Buhari speaks further on how health maintenance organizations monitor the facilities.
The relationship is intertwined, kind of. The facilities, the enrollees get service from the facilities. The facilities give service to enrollees. You understand? So this is a kind of intertwined relationship. But at the same time, that is why in any company, in any HMOs, you have a quality assurance department. This quality assurance serves as a check and balance department. A staff of the quality assurance of the HMO will go to facilities after every week, after every three weeks, to do case management, to look at the services given to enrollees, to make sure the services are up to standard.
In conclusion, he gives an assessment of the NHIA's performance in fulfillment of their mandates.
It's very good. It's very good. Looking at how it comes in, you know, and how the complexity of the Nigerian society is, but at least it is trying. Looking at the formal sector, for example, it is well achieved. People and their families are getting access to health care easily, and with time, I'm sure is going to, you know, so many states are now keen into coming up with their own kind of health contributory system. So it is getting through nook and crannies of the society, and this CBSHIP, community-based social, if given much attention, I'm sure the local government will also key in very recently, and people will be free to access healthcare freely.
That was Dr. Ahmed Buhari, Regional Manager of Songhai Health Maintenance Organization, speaking on issues surrounding the health insurance and the health sector at large. Coming up next is your questions answered. Do stay tuned.
Where do I register? How can I get? Where do I register?
How can I get enrolled? How can I get enrolled?
Question: can an enrollee access healthcare services outside his or her state?
We have a list of accredited healthcare facilities all over Nigeria, and you are entitled to, as a referral case, you could be referred from Abuja to access care outside Abuja. You could be referred to any hospital with the adequate skills, manpower, and equipment to treat you in any part of Nigeria. But again, at primary level of care, you are restricted to one facility. And that facility is what we call your primary healthcare provider. So you are registered with healthcare with that particular hospital or health center, and you are to go there to access care at the primary care. That hospital is capable of referring you, like I said earlier, to any other hospital.
Where do I register? How can I get? Where do I register?
How can I get enrolled? How can I get enrolled?
It is a program that is designed to ensure nobody is left behind in the health insurance ecosystem.
It's an excellent scheme to support Nigerians.
I've been benefiting from this scheme.
It's very nice. We really enjoying it.
We appreciate their effort.
This is where we draw the curtains on this episode of the program. If you have questions or comments, please send them through any of our contact mediums on your screen. You can also watch the program anytime, any day via our YouTube channel. Join me again, same time, same station for another episode as we continue to bring you more stories of happenings around the National Health Insurance Authority. See you next week.